Thank you for the opportunity to join the 2021 New Agro-Food Research Institute of Jungang University. I am Jung-Sun Lee, professor in the Department of Nutritional Sciences at the University of Georgia and principal investigator for the University of Georgia Supplemental Nutrition Assistance Program Education, in short UGA SNAP-Ed. I am delighted to share our online e-learning, nutrition education, and obesity prevention for low-income adults. For this presentation, I will introduce the SNAP-Ed program, especially at the University of Georgia, to provide the context of our e-learning program first. And then I will share our experiences in developing, implementing, evaluating Foodie Talk, a smartphone-based asynchronous e-learning program for low-income adult Georgians before and during the pandemic. SNAP-Ed is the nutrition education arm for SNAP, formerly food stamp, and SNAP-Ed is the USDA's largest community nutrition education program for low-income Americans and intends to address diet and physical activity-related health disparities. Under the Healthy Hunger-Free Kids Act of 2010, Section 241, SNAP-Ed was reestablished as Nutrition Education Obesity Prevention Grant Program and requires to use evidence-based, comprehensive, community and public health approaches and rigorous evaluation. UGA SNAP-Ed has been funded by the USDA SNAP-Ed grant program since 2013. We provide evidence-based, culturally appropriate nutrition education and obesity prevention targeted for low-income Georgians. We layer complementary interventions to achieve large-scale, sustainable positive health outcomes based on the collective capacity of UGA and the UGA Cooperative Extension and collaborations with diverse stakeholders and communities across the state. Since 2013, UGA SNAP-Ed has been developing comprehensive multi-level interventions targeted to unique needs of low-income Georgians. Our program development started by adopting a traditional direct face-to-face nutrition education based on 3 food talk curricula using a peer educator model in 9 urban and rural counties. Then we have developed social marketing campaigns using a variety of proven social marketing approaches, including print media, social media, mass media, and digital advertising, including texting campaign in all Georgia counties. We have also been actively developing several PSE interventions to make healthy choices more accessible and easier through policy, systems, and environmental changes. And these interventions are at the early care and education programs, 4-H youth programs, food banks, and faith-based organizations in select counties. We have been particularly interested in developing and utilizing an innovative smartphone-based online e-learning nutrition education program. This is because this type of intervention has a high potential to reach and impact more audiences with increasingly ubiquitous access to the internet and internet accessing devices. And this program is also available across the state. The goal of UGA SNAP-Ed e-learning is to expand nutrition education opportunities statewide by providing alternatives to those who are unable to attend traditional face-to-face classes due to transportation, location, and childcare issues, and to those who can attend classes but would like a review, and to those who seek information at the point of nutrition-related decision-making. We want to create a program participants can access through any mobile devices that have access to the internet. They can work through the lessons at their own pace, providing increased accessibility and flexibility to their learning experience. The development process, however, was not straightforward. When we first started the development back in 2014, very little guidance and research were available on how to develop a smartphone-based e-learning nutrition education program for low-income populations. Much of the Foodie Talk development followed trial and error, and it took several years for us to make our initial e-learning program up and running. And the diagram summarizes here our development process and highlights the complex, non-linear, and iterative process requiring an interdisciplinary team of professionals with expertise in the nutrition content, instructional design, web development, videography, and evaluation with unique resources. Lessons learned from the Food eTalk development process suggest it is critical to include all key team members from the beginning using effective inter-team communication system and understand the unique resources needed, ample time for development, and employ an iterative development and evaluation model. What is the platform for Food eTalk? Unlike most of e-learning programs based on a learning management system or app, our e-learning program was established as a web-based learning program with a goal of reducing barriers for potential participants to assess our program, as well as providing information for our participants when making critical nutrition-related decisions. Our website is optimized to enhance user access and experiences, as well as evaluation capacity. So some of our online design goals include streamlining site and content navigation and reduce the number of clicks a user must make to launch a learning module. Our e-learning program was developed as research-based nutrition education resources. We employed a comprehensive formative evaluation spanning several years using a longitudinal mixed method, a single case study design. The evaluation uses a series of focus groups, individual interviews, demographic and internet habit survey, and user tracking data. For simplicity, I'm showing you the research process as a linear timeline, but the process was really iterative. That is, we made the program, tested, gathered feedback, fixed it again, updated a new program, tested, gathered feedback, fixed it again, and so on. The key takeaways from our formative evaluations are e-learning is a feasible nutrition education approach for low-income eligible Georgians, and our priority audience has access to the internet and possesses digital literacy skills. We are able to identify skill-based step-by-step specific topics and recipes informing the development. But the content format needs careful consideration to motivate people to use e-learning. So people wanted games, videos, shorter and entertaining lessons, and wanted information about healthy habits. Some of our engaging features adopted include the development for smartphone screen size. And our program can easily adjust it to different size and type of mobile devices. And following the e-learning and adult learning theory, we use visual, short, user-friendly lessons. We also added the additional educational videos. And across the lesson, we highlighted and featured sudden influence recipes and foods. We kept voiceover and closed captioning to meet a 508 compliance. Food eTalk uses interactive games and tools, including matching games and multiple choice questions. And for example, the upper right images on the slide show two of our interactive sliding and matching games focusing on portion size and also added sugar activities. We augmented lessons with cooking, exercise, and just-in-time educational videos. We provide a relatable voice to narrate the videos. And for all the lessons, we use a soothing sudden voice leading the participants through the lessons. We recognize participants to complete the program with nutrition education extenders to enhance their engagement and motivation. UGA SNAP-Ed developed two smartphone-friendly e-learning nutrition education programs, Food eTalk and Food eTalk Better You. Both of programs are based on the content of two validated curricula for our face-to-face direct education programs. Food e-talk features 6 10-minute interactive lessons, cooking videos, and just-in-time videos. Food e-talk Better You consists of 4 3-minute interactive lessons and cooking, exercise, and just-in-time learning videos. These programs focus on general healthy eating, grocery shopping, cooking, food safety, and include key principles from the dietary approaches to stop hypertension and diabetes prevention programs specific to low sodium, high fruits and vegetable, limited added sugar, and portion control. And some of the adaptation for online delivery include allowing participants choose the order of lessons of their choice, and significantly shortening the length of lessons, and also allowing start and stop feature. This slide shows what and how participants assess and use our e-learning program. Participants will learn about and visit our website, www.foodtalk.org, for online nutrition education resources. Our resources include blogs, videos, recipes, glossary, and in-person class information. And participants can sign in and create a profile through our website, site, and our social media platforms. And they can go through the eligibility determination process based on the public assistance program participation and residential zip code. If participants are eligible, they are directed to a Qualtrics survey, sign a consent form before starting a lesson, and assess to 10 learning modules in any order and is on pace, and complete a post-lesson Qualtrics survey. If participants are not eligible, they are redirected back to the website to assess free nutrition education resources that are open to the public. We recognize participants who complete the programs, and upon completion of all 10 lessons and surveys, participants receive a completion certificate, both online and printable format, and instructions to request educational extenders from the County Extension Office. So here are the images of the certificate and samples of the educational extenders participants will receive when completing the lesson. Some of the examples of the extenders include measuring cups, spoons, calendar, reusable grocery list, water bottle, recipe cards, cutting boards, resistance band, and reusable grocery bag. And the distribution of these items is coordinated with corporate extension. Once the participants complete the lesson, he or she will receive a certificate of completion, inviting them to connect with their local extension offices and visit them to receive the listed items. This could grant another learning experience since many participants may not be aware of the other programming opportunities offered by Extension, such as 4-H, gardening, and additional nutrition education and chronic disease management programs. For the statewide e-learning implementation, we have been using systematic e-learning promotion and recruitment strategies while closely working with the UGA Cooperative Extension and community partners. Through this UGA Cooperative Extension Network, we promote UGA SNAP-Ed e-learning programs by making and sharing e-learning and related resources available on our website, and distributing Learn Online postcards, inviting people to sign up for paper and online newsletters, and following us on social media. And we also actively coordinate outreach events and provide support from the state office. And as I mentioned earlier, we distribute nutrition education extenders for e-learners at the county extension offices. Through the Community Partners Network, we promote our e-learning program for outreach and marketing opportunities. We work with key community partners who serve low-income Georgians. Some of the examples include SafeNet clinics that typically provide free or reduced cost medical services to low-income patients, and care management organization who oversees administer public health insurance program targeted for low-income populations, such as Medicaid, and also county health initiatives. Here is an example of food e-talk promotion and marketing strategies through the Cooperative Extension Network. In January 2020, just right before the pandemic lockdown, we hold the statewide rollout of our e-learning program. This event was planned during the 2020 UGA Extension Conference, which typically attended by around 500 county extension agents. We offered demo booth and recipe demonstration featuring our popular Southern recipes and scavenger hunt. Also, we conducted e-learning online survey as part of the e-learning implementation research project. As part of this effort, we introduced Extension County webpage e-learning banner as shown at the bottom of this slide. And we provided UGA SNAP-Ed blog series featuring our e-learning program. And we monitor e-learning programming reach by the extension district and county. And we have been carefully conducting systematic evaluations to monitor the progress and outcomes of our e-learning program. So for the process evaluation, we display many of the process metrics in a dashboard in our website for website administration. And we also created an e-learning monitoring report monthly and share with our extension and county counterparts. For the outcome evaluation, we use post-lesson Qualtrics survey. We adopted a retrospective pre-test design because a traditional pre- and post-test design is not practically feasible. Our lesson completion duration is relatively short on average, and time for 2 surveys is pretty limited. We mainly assess users' change in self-efficacy and intention to follow specific health practices related to food resource management, food safety, healthy weight management, dietary intake, nutrition practices, or exercise. Here is an image showing an example of self-efficacy questions used in our post-lesson Qualtrics survey on a smartphone device. So with a one-time survey, we try to assess participants' perception and understanding of their confidence level before taking the lesson and now. And all of our evaluation findings are shared back with our funding agency, but we also share them with our university, government, and community partners and key stakeholders, including policymakers, administrators, and advocates through presentations and different types of publications. One of the popular and easy publications for distribution is infographics, as shown here for Food e-Talk report for 2020. And we have been also actively sharing our findings with other researchers and SNAP-Ed practitioners through academic presentations and publications. As with any nutrition education programs, e-learning has a set of challenges related to the needs for unique content, formats, evaluation methods, and budget needs. One key challenge is that SNAP-Ed e-learning programs should be targeted to and reach only SNAP-Ed eligible participants, meaning we have to collect participants upfront any personal information to determine their eligibility. This data collection turns some people away, So we have been diligently streamlining the process and reduce any potential burden related to this registration process with a user-friendly design. And e-learning programs require continued technical support during both development and long-term maintenance. So technological capacity can greatly affect users' experience and need to be addressed as the program is developed and implemented. I'm going to talk briefly about our e-learning program experiences during the pandemic. And the COVID-19 presented unforeseen challenges to SNAP-Ed program in 2020. Our e-learning program was, however, uniquely positioned to respond to these challenges. Food eTalk provides a safe and effective alternative to face-to-face nutrition education for eligible adults 24/7 in all Georgia counties. Our ongoing efforts in establishing effective e-learning implementation model helped us augment our capacity, quickly adapt our programming during the social distancing times. So we widely disseminate the program during and after the COVID-19 lockdown using alternative programming models. We offer e-learning either as a standalone programming model instead of face-to-face programming or as a hybrid model, which I'm going to share one example in the next slide. COVID-19, however, also presents some new opportunities. So UGA SNAP-Ed e-learning program was recognized by USDA as a research-tested and evidence-based program for SNAP-Ed programming in September 2019. And Food eTalk is now available for national programming beyond Georgia. And we have been working with other states to offer more nutrition education and obesity prevention through e-learning to low-income Americans. We also look for an opportunity for rigorous impact evaluation in collaboration with other SNAP-Ed implementing agencies. Here is an example of our e-learning strategies that has proven to be very effective during the COVID programming involvement. The program I wanted to share with you is Fulton Fresh Mobile Farmers Market. This program originally designed to bring free fresh produce along with face-to-face nutrition education to low-income individuals. The program has been serving hard-hit, low-income food desert areas in Metro Atlanta during the regular market season since 2011. During the pandemic and social distancing times, however, the original program model didn't work anymore. So the program quickly adapted a new delivery model, providing free fresh produce with a curbside pickup option and e-learning nutrition education to individuals at the eligible sites. So participants are encouraged to create a profile at foodtalk.org and complete a Food eTalk lesson weekly prior to coming to the events. As part of the e-learning promotion strategies, a banner promoting our website and e-learning program was created. And as shown here, this banner was been used in all Georgia County Extension Office website. And the Stuck at Home promotion flyer was also available both electronically and in print for mass distribution during various community events sponsored by schools, community organizations, or food bank. And we have also heavily used our social media platforms to promote Food eTalk program during the pandemic. So UGA SNAP-Ed e-learning allow us to reach and impact low-income Georgians with proven outcomes. We will continue to strengthen our e-learning capacity to improve eating and physical activity behaviors among vulnerable populations with a high burden of health disparities and social disadvantage in Georgia and the nation. Thank you again for the opportunity to share the lessons learned from our e-learning programming. Should you have any questions or need more information about our program, feel free to contact me. Thank you.